welcome to the Hot Flash Health Podcast, where we're dishing out unfiltered truths about menopause with a side of sass and a sprinkle of crass. Get ready to dive into the wild world of hot flashes, mood swings, and all the other joys of being a queenager. This ain't your grandma's podcast. We're here to chat about our bodies, our passions, our fears, our desires, all while navigating that roller coaster ride of menopause. Grab a glass of wine, tequila, or water, whatever. Kick back and let's ride this hot flash wave together. I'm Courtney Mamusha, and alongside me is my fabulous co-host, Dawn Fable. We're just two outspoken gals who aren't afraid to say it like it is. Now let's get into today's episode. Dawn, why don't you go ahead and introduce today's amazing guests?
Yes, today I am so excited to introduce these two powerhouse guests who are revolutionizing how we approach hormone health, diagnostics, and most importantly, aging with grace. First up, we have a friend of mine and a neighbor, Kate Daugherty, a functional nutritionist with a master's in human nutrition and functional medicine. Kate is not only an amazing human being, but she's a board-certified nutrition specialist and co-founder of the Facility Functional Medicine Clinic here in Denver. Alongside her sidekick, we have Dr. Mitchell Rasmussen, a fully certified functional medicine practitioner with a doctorate in chiropractic. Although you won't catch him cracking backs here, Mitchell has completed a postdoctoral training in functional medicine and immunology with a passion for chronic disease, autoimmunity, and endocrinology. So together, they treat patients by digging into the root cause, which is so important, of systematic dysfunction, hormonal imbalances, autoimmunes, GI issues, and you name it. With their cutting-edge approach to personalized health, they're here to help us understand why knowledge is power and the importance of advanced testing, and what it really, really means to truly advocate for your health as you age. So buckle up. Let's redefine what it means to age with confidence and balance using the power of functional medicine. Holy shit, you two are smart.
You made us sound good. Yeah, thanks for that intro. Great to be here.
Yeah, we're excited to have you guys. I know, obviously there's a lot of people still learning what right path to go down. Like, how do I go down the traditional medicine path? Do I go down the functional medicine path? So maybe we could dive into what differs between the traditional healthcare system and functional medicine, and why do you think this approach is the future of wellness? I'm a big believer, but let's change everybody else's minds.
I mean, we've kind of come to this and realized functional medicine is really the way healthcare should work. I think more and more our traditional healthcare system is more of just a sick care system. So it has its role, it has its place when there's a surgery needed, there's certain antibiotics needed. But when you're just trying to live well, it really has failed us. It's failed us from a preventative approach, and it's failed us from optimal living and feeling our best. So that's where we've kind of come into this world of functional medicine, thinking, how is everything connected? How can we change our lifestyle, not just take a medication, but change our lifestyle, change our diet to affect how we live and how we feel?
And what we kind of came up with, what we're trying to practice, is something that we named middle medicine, where we want to use as much of the cool diagnostics like CT scans and ultrasounds and MRIs and blood tests and stool tests and all that stuff. But then let's approach it from a root cause analysis where we know that everything matters, everybody's different, and everything is connected. So instead of pulling out your gut problems from your skin problems or your hormonal issues, let's try to come together and have a conversation about how it's all related. And the cool thing is people are waking up. We have a lot of allopaths in Western medicine, physicians and physicians assistants and nurses and nurse practitioners that are now coming into the clinic. And that was really kind of a moment for me in my career to realize that we're onto something, because the people that are serving up some of the medical approaches aren't interested for their own health. And that kind of told us that we were on a good path. But yeah, we work a lot with specialists, big referrals into the system as needed for certain procedures and diagnostics to get them covered by insurance. But I think when you zoom out and you look at how everything's connected, that's really where we make a living, is helping kind of put it all together.
Thank you guys, first and foremost, for taking that approach. As Courtney said, she's a huge believer. I am a huge believer in this. I have a very strong opinion that the medical system is not only incredibly fragmented, dismissive, but archaic. And so, what a fucking concept, looking at the issue. Like, hello. So, thank you for that. Here at Hot Flash Health, obviously, our subject matter is to bring in incredibly smart people like you and talk about aging gracefully, our hormonal health journeys, menopause, that preventative testing, biomarkers. You guys at Facility talk a lot about going beyond the basics, particularly in hormone testing. So many women these days, including myself and Courtney, certainly prior to this podcast, are very lost and confused as to what should we look for when it comes to hormone health, preventative health when it comes to hormones, especially during these very transformative times in our life with perimenopause and menopause. What is your advice to all of us women who are trying to navigate through this shit show of hormones, and where do we start with testing?
Something you said that I'm focusing on is dismissive. First of all, finding somebody that's willing to take the time to listen to you. We go and talk to young women now who are oftentimes put on birth control for any number of reasons, whether it be heavy periods or breast tenderness or weight gain or acne. And I push them to continue advocating to find someone who's willing to dig in more, even if they're not willing to run all this comprehensive testing, to at least spend time with you and listen to you. We were just this morning on a call with one of our distance clients in Phoenix who's been having a kidney stone for 2 months. And I believe if that was a 42-year-old man, not a 47-year-old woman, I think 6 weeks ago it would have been taken care of. But she was sent home with muscle relaxers, told it was a back strain. We got a CT. There's a clear kidney stone. It just, that's a big thing that from the beginning, when you said dismissive, oh my gosh, we see it all the time. So find someone that's willing to at least hear you and think about you as a person who matters, not just a collection of tests. But then from testing, I mean, what are you thinking?
I think part of it is that traditional providers are really limited in their resources. And one of the biggest resources they're limited in is just the time to sit with you and to listen to you. So they reach in their toolbox and give you what they can, but in a 7 to 12 minute visit, they're not going to be talking about your sleep habits, talking about your nutrition, talking about your community and support around you. So that's a big problem of, can you find someone who has the time to listen? And I think it falls on women really to take the power back. And that means educating yourself. So that's what we're here to help you with today. Is what are the stages of perimenopause? Do you know what they are? Are you familiar with them? What are the common symptoms to recognize that could be associated with that change? What are the testing options? We'll get into that. And then potential treatments too. So when you go to a provider, can you have a conversation, a productive conversation around those potential treatment? I think it's important that women know themselves. So recognize, oh, I'm starting to notice these changes. Start to track those changes so you have some data behind it. When are things happening? Even just length of cycle is important to track. And then continuing to document what's going on so that you have the power when you walk in to see someone. Hey, here's the data, here's what's going on, here's what I need help with, here's what I want to ask about. And it's sad that we have to put so much of that on ourselves, but we have to take that power back. And like you said, find the right support. I think sometimes we forget that you are allowed to fire your doctor if they're not getting
Yeah, that's true. That's true. You're fired.
I have a saying, you go to someone asking for help and they run a bunch of tests telling you everything looks normal, fire them because they're gaslighting you.
Yeah.
Clearly they didn't run the right test if you know something's wrong and you're not getting that investigation. And I would say for everyone, it's about advocating, because like people will sometimes come to me and think I can tell them what's going on. It's like, we need to have a 90-minute conversation. Then we will run some labs. I can't look at you necessarily and tell you what's wrong. But to answer your question about testing, I think an interesting concept that I'd love maybe in a future time to dig into is the estrobolome. And it's how the gut microbiome interacts with estrogen. When we think about elevated estrogen, or even in the perimenopause years, the waxing and waning of estrogen, until finally the cessation of the menstrual cycle, a massive part of that is how is estrogen actually detoxified through the gut microbiome. And we know there's a big aspect there of looking at the gallbladder function and thyroid, because and then, so when you think about testing, yes, hormones and the patterns of metabolites are really important. So we'll look at E1, E2, and E3 from an estrogen perspective, but then we like to map how they're being detoxified through the phase 2, phase 1 liver mechanisms to make them water soluble. But then when we start to think about certain metabolites being elevated, there's a saying in natural medicine, where bile flows, toxins go. One of the main ways that we can help make estrogen get out of the body is through the bile and the gallbladder. A lot of women have had their gallbladders ripped out because there was a stone in it, or because they had sludge, when meanwhile we should have figured out that maybe it was a thyroid condition causing low output of T4 and T3, and those are the principal drivers of the ability of the gallbladder to secrete bile. So this is again where everything is kind of related. I think a full thyroid panel is vitally important for someone transitioning through perimenopause. Metabolic panel, looking at blood sugars. I mean, there's all so many things beyond just the hormones. And then I think gut microbiome testing. There's plenty of literature now to show that gut dysbiosis, which is the microbiome environment being off from things like alcohol and in too much amount, stress, non-steroidals, antibiotics, infections, can actually lead to this change in the estrobolome that then leads to estrogen changes that only exacerbate through menopause. When you think about a big aspect of transitioning as well as adrenal health, and if your adrenals are jacked up heading into menopause, it's going to be a wild ride once you get into menopause. So that's a big thing that we stress, is the stress management too.
As if we need a wild ride, like all of us are on this wild ride. I mean, let's make it fucking crazier. Like what? That's nuts. And you're such a wealth of information. But going back really quickly, Kate, you talked about the stages of our hormonal health journey. Sad women don't know these stages. I'm convinced that a lot of your traditional medical practitioners don't know these stages, seeing as though they're getting an hour of training around menopause in their studies. What are, for those of us who don't clearly know, what are those stages of menopause, and what are symptomatically, I know it's very different for each woman, but what are key symptoms that you see in each of those stages?
Yeah, so that's the thing, is no one walks out of a textbook. So we have these loose ideas of these stages and the symptoms associated with the stages, but because everyone is individual, your output, your symptom could be different from the person next to you, even if you're the same age. So those age ranges are really loose, but typically perimenopause is 5 to 10 years maximum, but 5 to 10 years leading into menopause, which is, we consider the cessation of the menstrual period, 12 months.
Yeah, if you have a cycle 350 days after the last one, you are still not postmenopausal.
Yeah. And 365 days
by rule. Yeah, there's no real blood tests. That's, I've had a young woman once, she ended up getting pregnant just fine, having a child, but she went to the doctor, and whether it was a misunderstanding or what, because of some FSH and LH levels that were elevated, she was told she was in menopause at like 37. And when all reality, it was brain inflammation, it was poor feedback from the gonads to the brain. And there's actually no blood test to diagnose menopause, because you can't rely on estrogen and progesterone being low, because that could be low just with an anovulatory cycle. You can't rely just on FSH being really elevated, which happens in menopause. Remember, FSH is follicle stimulating hormone. So its feedback, it's turned off when estradiol levels are elevated. And when estrogen falls in menopause, now the brain starts cramming that signal down to the body. And so, yes, it's high postmenopausal, but that's not diagnostic of that state. So it's really based on the cessation of the cycle to grade where you're at.
And so in that perimenopause, typically the progesterone starts to taper off on a pretty even bell curve, right? And the estrogen goes through a lot of cycles, so it can go super high, it can go super low, it can go back super high, super low before it fully tapers off. So it really depends on where, even in testing, where they capture you in that perimenopause state of high or low estrogen. Okay, so stages of menopause.
Totally.
We have, two big ones: perimenopause, menopause. The perimenopause is there's not clear boundaries on it. Yep, it could be 5 years, it could be 10 years, it could be 1 year. And that's where we have a lot of changes between progesterone and estrogen. So generally, if you walk out of a textbook, progesterone drops off nicely, but estrogen kind of bounces around. It can go super high, it can go super low, it can go back super high, go back super low, varies for a little bit, and then eventually tapers off as the ovaries stop.
Yeah, we like to remind women that the most stable hormones of your life will actually be in menopause. Yes, they'll be low, but that's where it really gets into supporting ovarian health. Contrary to popular belief, the ovaries in a postmenopausal woman are still working. There's different cell types, but you will continue to secrete a little bit of testosterone from them. And then, provided you have adequate calories, you will convert some of that testosterone into estrogen, but then the primary hormone source will actually be that adrenal gland. So I think that's where, we can really work to optimize the hot flashes. And 2/3 or 3/4 of women, as they drop in estrogen, will have the hot flashes. Having adequate DHEA production from the adrenal gland will help continue to keep that process online to support things like your brain, your cardiovascular system, your insulin sensitivity, muscle mass, bone density, all the things that we really get worried about with a postmenopausal woman. That's literally why adrenal health is everything.
Yeah, I agree.
So good. Dr. Hotness, Dr. Mitchell Rasmussen.
Dr. H.
Dr. Hot.
This is good for you today.
Yeah.
Oh man, you're hot.
Take your shirt off.
Smart. and Kate, you're beautiful and smart.
Yeah.
But getting back to Dr. Hotness and your smartness, we talked a lot about women having to advocate for our health, right? You spoke 5 minutes ago about how women are being gaslit by traditional providers, especially when it comes to menopausal symptoms. What's your advice, both of you, how women can really take control of their health and push for the testings and the intervention and the support and being seen? You guys do a tremendous job of that at the facility. Not everyone is like you guys, sadly. As women, how can we go advocate to find people like you?
Again, it's about knowing your body and trusting yourself and trusting your instincts. When you hit perimenopause, menopause, you've lived with yourself for 45, 50 years. When you don't think that something's right, trust that and keep asking questions until you can get someone to answer that.
And technically, no hormone testing is necessary after menopause or in menopause. So you will have to pay cash. You will have to probably go outside the insurance system. Just like with MRIs that we order, when we pay cash, we can get it much cheaper and we can get it today. If you use insurance, someone will cover it. Your deductible or your copay will be through the roof and you'll have to wait 2 months. Same thing with blood testing. We see this a lot of times. Your GP actually can't typically even get that qualified to be covered, so they're not even going to ask for it. And then with the advocation, it's about understanding how everything's related. When you think about the thyroid function, you go in with temperature dysregulation and maybe poor libido and brain fog and fatigue when you're in perimenopause. Oftentimes the only thyroid assessment will be a brain hormone called TSH, and that has relatively little to do with the actual circulating thyroid hormone levels. So asking for a comprehensive thyroid panel will probably never happen. When you come to someone like us or many clinics similar, basic standard workup has a full thyroid panel included, and then thinking not just about serum hormones when you're asking for help. And this is where a lot of providers say that urine testing for hormones is not validated, which simply isn't true. I'm not interested, especially because we advocate for HRT. And if we're doing HRT, whether you have a uterus or not, we want to balance that with something like bioidentical progesterone, which we do quite often, like transdermally or oral. And knowing how you metabolize your estrogen, even though your levels will be low across the board as a postmenopausal woman, you still need to know where the metabolites are going, because there's certain metabolites that are highly genotoxic. They can lead to uterine cancers and those types of issues. So I want the benefits of the estrogen, but I still want to see how the body's metabolizing. And that doesn't change just because you're postmenopausal. That's still your metabolism. So, like you said, asking for how you get there, I mean, I don't know. You have to find someone that's willing to look at your metabolism of your estrogens, look at the gut microbiome to know, okay, now I've got this woman who wants the brain, body, sex drive, cervical mucus benefits of the estrogen, but I want to make sure that I'm not running a risk of uterine diseases later on. That only happens from looking at the metabolite.
Yeah, I think you've talked about a lot of things in my personal journey, just with seeing regular doctors. I've had a lot of gut health issues and really didn't understand like why I would eat things, I would blow up, I would get really sick. And a lot of people listening know I lost two parents over the span of 2 years. So I was in a really big depression, stressed out, the inflammation. So it wasn't until I found a functional doctor as well, I wish I knew you guys a couple months ago, who has really helped me and kind of held my hand and looked at things in a different light. Because again, what you've said is going to the traditional healthcare path. They're just, I feel like they're as fast as getting you out the door as pushing you off for another 6 months. It's really that personal care that really helps. But on top of that, I know that stress is a huge culprit of hormone disruptors. How does chronic stress and inflammation impact a woman's health hormones, especially during menopause? And what can we do about it?
So I think first I'll have Mitchell talk us through a little bit of the physiology of the adrenal glands and stress
Okay.
hormones, and then I'll jump into kind of lifestyle. Okay, what do we do now?
So this is where the feedback loops are everything. When we think about stress or the adrenals, what we're really talking about is the hypothalamic pituitary, which is in the brain, access to the thyroid, to the ovary, to the adrenal gland. Essentially, the brain hormones are what tells the endocrine glands what to do and how much of those things to do. So anything that's inflammatory, whether it be from an infection, perceived stress or threat to the system, a trauma, poor diet, anything that drives body inflammation has the potential of increasing brain inflammation. And the typical output of an inflamed brain is an increase in a hormone called CRH, or corticotropin releasing hormone. CRH has a few different jobs, but essentially it stimulates the brain to secrete these corticosteroids. So the brain will secrete a hormone called ACTH. It drives adrenaline release, and a few minutes later, from the adrenal gland comes cortisol. Cortisol's main job is a homeostatic, balancing anti inflammatory hormone. It comes from the adrenal. Its job is to essentially bring you back to baseline after the adrenaline release from the perceived threat. It's potently anti inflammatory, which is why things like corticosteroid injections are anti inflammatory injections. The problem with most of us living in this world is we're living in what we call an all gas, no brakes, where we've had so many chronic stressors and inflammatory drivers. The brain is chronically inflamed, the adrenaline is chronically being put out. That's going to work every time. That's evolved. That's going to keep your heart rate up, keep your blood pressure up, so you can be very on top of things. You can run away from the threat. The issue becomes the resistance peripherally to cortisol, or the inability of the adrenal gland to keep up. So you might have on a saliva test, you might have really high cortisol with chronic stress, but due to the inability of your cells to continue to respond to that threat, you're essentially not getting the benefits of it. And then that obviously reinforces inflammation. If we don't have the benefit of this anti-inflammatory hormone due to the chronicity of its elevation, now, even though cortisol is there, the body can't respond to it the same way. So I think that's the big thing with knowing that the adrenal gland is the primary source of hormones postmenopausal, from DHEA specifically, which converts into the sex steroids, and DHEA gets messed up with elevated cortisol. That's kind of where it's vitally important to balance out the brain chemistry so that you have normal cortisol levels. You're not getting these massive waxing and wanings.
Mm-hmm. And so when I think about managing inflammation using mostly nutrition, diet, there really isn't a perfect menopause diet, perfect perimenopause diet, perfect anti-inflammatory diet for every single person. I think nutrition is deeply personal because biology is so different for every person. So the commonalities I see in a healthy eating pattern to help control or help maintain the best adrenal health are you eating in a way that balances your blood sugar? Again, that can look a little bit different for every person. Does it have to be completely low carb? No, it doesn't.
In fact,
In
probably
fact,
not
it
low
probably
carb.
doesn't. Yeah, exactly.
Yeah, not
Right.
for women, low
Yeah.
carb.
I mean, we need mashed potatoes, okay? Let's be honest.
Are you eating in a way to avoid inflammatory triggers? And again, that's going to be a little bit different for every person. Are you eating enough anti-inflammatories to balance it out? Things like high intake of omega-3 fatty acids, colorful berries, fruits, plant sources of phytonutrients from vegetables, nuts and seeds, herbs and spices. All of these are going to help balance any of the inflammation from any source. And then are you eating in a way that supports your digestion and optimal detox, as we talked about with estrogen or any hormone, adequate fiber, pre and probiotic rich foods, amino acids from proteins to help with the detoxification process in the liver.
I think detox is thrown around a lot. Detoxification,
Yeah.
organ systems, right? We've got the liver, gallbladder, gut. You've got the kidney through the urine. You've got sweating through the skin, and you've got the lungs through exhalation. So when we're saying supporting detox, we literally mean, are you getting the raw materials brought on board that support the enzyme systems within those tissues to do their job more efficiently? It's not about doing citrus or a celery detox or cleanse or just essentially make a lot of expensive poop. What we're literally talking about is, are you getting those raw materials through the system so that the system can be efficient? And a big one, if we're doing HRT, is, are we getting enough of things like sulforaphane and cruciferous and methane containing nutrients? Because that will help, again, mitigate some of those potentially proliferative effects of estrogen that are unwanted.
I don't know about you, but I feel like I need a dictionary. I'm like proliferous vegetables.
Tissue
What?
growth, right? That's when we think about when we think about estrogen, it's very much a building block for tissue, good and bad. So muscle, bone, brain health, but also potentially cancers, things like that. When we think about progesterone, that's kind of what fills in the gaps and helps support that balance between those two.
And Courtney, you're not alone in that. This is why we together, because that's how he talks, and then I try to bring it down too. Okay.
Thank God you're there, Kate. I'm like, can you put that in Courtney terms?
You bring up something interesting, and you mentioned before that you guys are advocates of HRT given the right situation and given your patients would benefit from it. There's been a lot of controversial thoughts around HRT. There's also been a lot of evolution and thought leaders like yourself that are seeing the benefits of HRT. One, why do you think that HRT has been controversial? Two, what are you seeing with the evolution of HRT and some of the benefits for women in their aging cycle?
Yeah, I love that question because there is a lot of misnomers, a lot of things clumped together, just like looking at, meat causes cancer. You dive into the research, processed nitrate rich deli meats cause cancer. And those are associated with things like smoking and sedentary. So when it comes to the hormone conversation, my mom is a classic example. She had a hysterectomy at like 42 and was put on Premarin, which is, mare pee, essentially pregnant mare piss. It's horse pee from a pregnant animal, and that has these synthetic estrogens that don't even mimic real estrogen, and they lead to all sorts of problems. So a lot of these women, if they had this done in the early 2000s, they were told, the estrogen is bad, so they lost potentially benefits because it was such an improper form. Same thing with synthetic progesterones. A lot of the synthetic progesterones aren't even progesterone, they're progestins. And progestins actually are converted from testosterone, so they don't even really function like progesterone. We know that those have nothing to do with things like bioidentical estradiol or bioidentical progesterone. When you look at the data on those, very safe, especially if you're balancing out the estradiol with good phase 2 liver detox and adequate progesterone. I think the controversy came because of the old synthetic forms of the hormones that were given that we know are associated with side effects, similar to like contraceptive, oral birth control. It's a synthetic hormone that hijacks your system, and it's not a normal feedback, so the body works to get rid of it.
And it's become a big risk benefit analysis where I think the risks, even going back to the 2000s, were significantly blown out of proportion, and we threw it out without considering what those benefits were.
Yeah. I mean, again, I'm just sitting back like, whew, I need to come in and lay on your couch and be like, okay, I need a therapy session after all of this. There's so much to go through and dive into. And speaking of therapy in our brains, let's talk about brain health, bone health, and cancer risk. Let's just do a nice little turn of events there. I mean, as we women age, bone health is important, obviously, brain health is important, and the risk for cancer becomes significantly higher. We're more concerned about it, especially with women going through HRT. So, what are some of the most important things women should know about managing all of these risks?
I think, first of all, making sure there's weight loading, weight bearing exercise, sleep, stress management from the foundation. And then, like we said earlier, looking into that estrobolome, looking at your ability to glucuronidate, which is a cool word you can Google. And that's how the liver or the gut microbiome helps get rid of things like estrogen. Um, I think some women are probably put on too high of doses, in my opinion, and that's when you need to work with a provider. I'm big on frequent testing for someone on HRT, not once every even 12 weeks, potentially once every 3 to 6 weeks, especially if there's pellets. I want to get an idea about where this is going because now you can really help mitigate some of those risk factors.
Yeah, and that's one of the pitfalls of having a standard dosing for every woman is your metabolism's different. That's why we want to know how are you metabolizing your hormones so that we can titrate a dose for that, or how can we support it from the other end? Like we mentioned, the cruciferous vegetables, things like broccoli, Brussels sprouts, sulfur-rich vegetables, things like onions, garlic, to help either move things quicker through phase 2 detoxification, that big word, glucuronidation, or having adequate fiber to bind and remove.
Yeah, and when
Gosh.
the big words, like when we think about phase 2 liver, everyone says that, but we're really looking at these metabolic processes using antioxidants, using things like B vitamins, your B12. That's a methylation supporter, and methylation is one of the prime things that we actually measure in everybody on hormone and blood. Urine and blood hormones is working through how well are they methylating their estrogens, and we know that same methylation gene actually helps you get rid of things like catecholamine, so your dopamine. So there's a big relationship between low hormones postmenopausal and low GABA. What's a primary symptom of low progesterone or someone that's not cycling is insomnia and anxiety and irritability and hot flashes. And yes, there's an estrogen component, but really we're looking at how progesterone, when given postmenopausally, can help increase GABA in the brain, which is the primary relaxing neurotransmitter. So there's that massive interplay. You mentioned brain health. It's not just about estrogen keeping that tissue, it's also about getting rest. So an unrested brain is going to be an inflamed, stimulated brain that's highly anxious and highly aroused and then becomes exhausted. And now
I
you
don't know
get,
about you, but my brain is like GABA, GABA do, so it must be exhausted.
yeah, I mean, there's a lot that you can do with that. Even like L-theanine, is a common product we use for GABA and Hinokiol and Igarin. There's all sorts of different natural compounds that you can work with that receptor.
God, you're such a wealth of information and you're so informative around so many different things, right? Preventative diagnostic testing, nutrition, inflammation, hormone health, all of these things. With that being said, you have totally sold me on your practice, on your knowledge, on everything that you bring to the table. I know you guys have a facility actually here, no pun intended, the facility here in Denver. Do you treat clients from a distance and with telemedicine? And if so, tell us what a typical process would look like for one who's interested in spending more doing these diagnostic testings with you and having you support their general overall health and wellness. What does that look like if I want to be, which I do, want to be a patient of the facility?
Yeah, so we see people from all over the country, actually all over the world now. We see people out of the country, but telehealth is a huge part of our practice, and it's really opened that access up to people who don't have the provider that they can go to. So yes, very comfortable with that. And then as we mentioned, it's very personalized medicine. So we don't have here's your perimenopause protocol, here's all the tests we're going to do. We actually start with an initial visit. It'll be both of us for 90 minutes, and we're going to go through all of those categories. We're going to talk about your stress, your sleep, your poop, your diet, your relationships. We're going to talk about everything.
To chew your food.
Everything. And then after that visit, that's when we can really say, okay, here's kind of our main ideas. Here are the tests that we think are most appropriate to get some data to take some action steps. Once we get that data back, we'll sit down and explain it to you in detail. I will interpret it in a report.
I get pretty.
I was gonna say, is there a dictionary that comes with this, or?
I put it all in a big report with some action steps to work on, and then it's just a continual relationship of, okay, what is going well, what changes have you made, what do we need to still work on, then just kind of keep that open relationship going.
And I think, education is one of our prime core values, is who we are, not just, oh, let's create core values for the business. It's literally why we're friends and why we work together, is our belief in the self-empowerment through the gaining of knowledge. And so I sometimes, typically I'll tell people, like, I don't need you right now to understand every word I'm saying. What I want you to get is like a lay of the land, and how now you can see that, oh, there's something with the thyroid and why I have some right upper quadrant pain when I eat fat. And like, I understand that my gallstones can be mitigated. And that's why I'm more inflamed and bloated when I'm about to have a cycle, because my bile isn't clearing estrogen. And as long as you get kind of the big casting characters, we'll fill that in as we go. And I think I do push people to learn, but after a visit, you're going to get blogs and videos that we've created that can help kind of really talk you through specific aspects of immunology or whatever's happening, because an educated, informed patient is now someone who knows what to look for when they need help, or if they can solve something on their own.
And it also matters for their greater community too. As more and more people get educated, they share it with everyone else around them, and it's that collective knowledge that goes up that we love to see.
Yeah, so I think sometimes it maybe does seem maybe a little heavy on the outset, but it is always related back to the general trend of what's happening here. And then I also want you to dive in after this. Our style of medicine only works if you're willing to be self-educated and self-driven. One of the best things we love is have a partner come with you if you're in a relationship. Like, let's see that cohesiveness as a team, because so much of what we ask you to do is going to be, you need to change your choices. We're a collection of our genes, plus what people do to us, plus what we do to ourselves. And if we can really only modulate our own choices, that's the lever we need to pull.
Or you and I need to go in together and try to hold one another accountable and be able to speak through this, with
I mean,
our
I'd love that.
experience.
If we could, and video it and kind of like chronicle how our journey is, because I think it's so amazing. And finding a partner in health is like something that we all need and desperately need. And I applaud you guys for what you're doing. Obviously, it's beyond amazing, and we can't wait to be sitting on that couch or some other couch, whatever couch you have.
Or you mentioned you recently found somebody. What's your experience been like thus far?
So she's been great. I mean, the same thing. I spent probably close to two hours with her initially, kind of going through everything and a lot of questions. And she does a lot of muscle testing. So when I see her, she kind of goes through what foods I should avoid. She does a lot of blood work every so often. She talks a lot. I mean, all the big words you're talking about, but just kind of worked with my stress and my adrenal glands and everything. I just saw her this week. So she's like, oh, this is all wacky, and does chiropractic. But it's just been a great journey, because it's like, again, somebody that I feel is like, she's really become a friend of mine. And that's, you want kind of a doctor on your side, quote unquote, who knows you and knows your stressors. And she's like, okay, how's your relationship? How's your daughter? What's going on with this? So like, I can't speak highly enough about the process. And really, I love that you guys are doing telehealth. I was just kind of texting Dawn in the background, like, this is awesome, because there's people not only, in Denver who can use you. And obviously we've known a ton of people who could use you, but you offer this service via a non-conventional way. So I'm excited. And yes, if we can, Don and I could get in there and kind of do this process and share it through our channel, I think it would be awesome.
Yeah. Yeah, and I know, I want to be respectful of all of our times. You guys obviously have patients waiting, and we certainly would love to have you back on the podcast. I think you guys are a wealth of information, and we just scratched the surface today. We would love to hear, before we wrap it up, how people can find you, so we can certainly promote that and advocate for what you're doing. And thank you from the bottom of our hearts. Like Courtney said, thank you for doing what you're doing. Thank you for understanding that women need to be seen. Thank you for not being dismissive. Thank you for educating. Thank you, Dr. Hotness, for looking like your muscles like you do. And Kate, you being equally as wonderful. But tell us
And
where
beautiful.
people can find you.
Thank you for
And beautiful, yeah.
Yes, and
You
beautiful.
guys you
I'm
guys
sorry, guys.
might need to hire some ugly people over there.
Oh, it's going to be an interesting afternoon dealing with his head. No, the best place to find us is go on our website, thefacilitydenver.com. We've put a lot of work into that of explaining what the journey is like, what the steps are. You can read about different tests that we do, and then we do put a lot of work into our blog and our education there. There's a pretty handy search tool too, so if it's a specific topic you want to learn about, you can search on our blog. And then we put little tidbits on Instagram here and there.
We'll be doing more of that.
Education, yeah. So that is the best way to get in touch with us, our website, our Instagram. We'd love to meet more people.
Yeah, I appreciate the time to be able to chat about this. I mean, as we were talking about what we might want to go into today, we did say, I think this could be multiple. There's so many places that I would love to dive in. I think we hit so many little services, and there's so much more to say there, because a lot can come from just conversations. A lot of listening to this can start to plug and play with their own selves in very low risk ways, and just you're not going to feel worse by working on stress management and healthy eating.
We'll definitely have you back. I think there's a million words I need to look up now and then kind of dive into those. But you guys are a wealth of information. I just wanted to say thank you again from Dawn and I, and say that's a wrap on today's episode. Remember that menopause may be a wild ride, but together we've got this. Don't forget to follow us on Instagram, TikTok, and Facebook at Hot Flash Health. Stream and subscribe to our podcast on YouTube and Spotify, and share your thoughts with us anytime. Until next time, stay sassy, stay fabulous, and keep those hot flashes in check, ladies.